When I was diagnosed at 11 and a half, I didn't know I would be on a 12-year journey with cancer.
Cancer research is important because no one wants to die from cancer, but it's happening every day.
He was the first child in Canada to participate in this new treatment, this new trial that was being presented.
This young man has been braver than brave and stronger than strong. The recipient of the Medal of Perseverance is James Eacock.
Back in 2014, when we just got back from vacation, I thought I had picked up a bug or infection or something. So we did a lot of doctor visits and then eventually to the emergency room.
And it was a real shock. We had no idea that what we thought would be a flu or an infection would actually be a brain tumor.
And within days, I was in emergency brain surgery. It was tough moving in for almost 11 months for chemotherapy and isolation. Couldn't leave. I called it a prison cell. I had to go to a rehab hospital to learn to do almost everything again, to walk, to even have a shower again.
Life was great for a while. We got back into a really nice routine, and unfortunately, cancer came back. James relapsed about 18 months after his initial diagnosis. So that started a long journey of treatment for medulloblastoma. James has had 4 brain surgeries. He's had countless rounds of radiation. He's had chemotherapy, and he's also been fortunate enough to be part of 2 trials for new drug treatments and drug therapies for brain tumors. The first trial, he was the first child in Canada to participate in this new treatment. Did really well going through that whole trial treatment and was able to come back into a normal sense of life, as we call our new normal. He was able to go back to school, he was able to graduate, he was able to focus on some of the activities he liked with softball. He was able to get his first summer job with the Toronto Blue Jays, which was his dream job. James did relapse again and had surgery and again recovered after a long period of rehabilitation. The second trial that James participated in came about as a result of the connection between Dr. Hon Leong and James.
James's case is really special. We found that cancers like his, which is a rare cancer, expresses certain proteins that are excellent drug targets. But those medicines that are for those targets have never really been applied in a rare cancer type like his.
Together with Dr. Leong, we are working to try to understand each patient's cancer individually. Every discovery brings us closer to new therapies that can be tested in clinical trials with the potential to meaningfully improve the quality and duration of patients' lives, like James's.
What we've done together is find a way for him to gain access to that therapy called radioligand therapy.
This second trial that James is participating in, it's promising in terms of offering hope to patients.
We need to keep doing cancer research because now more and more we're seeing the emergence of rarer types of cancers.
I still have my dreams to one day be part of the Toronto Blue Jays organization, with being in the clubhouse or being on the grounds crew, continue with my coaching and volunteer work I do, being a board member for the Newmarket Stingers.
Unless you're in treatment and unless you're the parent of a child that's in treatment, you don't really know all that goes on to make these trials a possibility. And it's only now that James has now been on 2 trials can we fully appreciate just what we have here in Canada.